Thanks again for joining us for today's event, Practice Workflow, Maximizing Office Efficiency and Scheduling with Invisalign Treatment. At this time, I'd like to turn the floor over to your host, Justin Taormina with Align Technologies. Justin, you now have the floor.
Thank you, Heather, and thank you everybody else for joining today. I appreciate your attendance. Today we're going to be discussing Practice Workflow, Maximizing Office Efficiency and Scheduling with Invisalign Treatment. First, we'll get to know our presenters a little bit better, have a little background on both of them. Then we'll go through each of the distinct topics we'll discuss. First will be logistics and how to structure each team member's responsibilities to maximize productivity. Second will be scheduling, how to schedule effectively to maximize the busy after-school hours. Third will be solutions that work for small and large practices. And then fourth will be we'll open it up to any other questions that you seem to have burning. Following that portion, we will give you a link to complete a short survey. We'd like to know how we're doing, obviously. Once you complete that survey, on the second page, there will be a link that will connect you to the certificate for the CE credits. So make sure you go in and see that. So first today, our first panelist, is Michelle Shimon. Michelle is the owner of Shimon Signature Consulting. Having worked in the field of orthodontics for the past 25 years, Michelle is passionate about teaching and training others in practice processes and influential communication techniques. Michelle consults with practices on their systems to promote training, growth, and success in all areas. As a practice manager for a doctor in Kirkland, Washington, Michelle took her doctor to elite status while only seeing patients 2.5 days a week. She continues to lecture for training workshops across the country. Michelle has 2 teenage sons currently in Invisalign treatment and experiences firsthand the benefits it brings to busy families. Next, we have Kathy Hazen. Kathy began her professional career in automotive sales and transitioned into the world of orthodontics as a treatment coordinator for Drs. Dale and Lisa Davis of Davis & Davis Orthodontics in 2009. She currently is the operations director of Dr. Michael Lanzetta and upcoming treatment coordinator for the Detroit Orthodontic Specialist, which will be an Invisalign exclusive boutique practice in downtown Detroit. She's extremely proud to be part of this practice, which will be starting to see Invisalign-only patients as early as September. She considers it an honor and a privilege to be part of helping 2 practices obtain top 1%, utilizing Invisalign's strong focus on patient care and experience. In 2011, she created 3 Leaf Consulting, and in speaking for Invisalign across the country, has been influential in aiding many offices to recognize their growth potential through better customer service and superior treatment with Invisalign. So this is how things will be progressing today. You will submit your questions, as Heather had mentioned, through the question and answer pane on logistics, scheduling, and workflow. I'll compile those questions and then direct them towards Kathy and Michelle, and they will provide their insights on those questions. Any questions that we're not able to answer today, we'll aggregate and send out a follow-up email in 2 weeks, doing our best to answer those questions and making sure you get the information that it is that you need. So without further ado, we will begin. Our first section will be on logistics and the structuring of team responsibilities. So we've already had some questions submitted in the question and answer pane, so I'll direct this first question to Michelle. Michelle, the question is, how do you structure team member responsibilities to maximize productivity?
Excellent question, Jordan. Thank you. I do encourage having an Invisalign coordinator that can be the key point person in understanding the flow of our patients who have started their Invisalign treatment. I don't separate Invisalign appointments from adjustment appointments on our schedule template, so all of our employees have the same capability in treating our Invisalign appointments that come into the practice. What we do is we do fully utilize the benefit that Invisalign appointments provide in allowing us to see patients in that 10 or 15 minute time spot, as opposed to an adjustment appointment, which is 30 or 40 minutes. So I do, hello, are you there?
Sorry, whoever that is, can you please
Jordan?
put your phone on mute? Yes, I'm here.
Oh, I apologize. Something else that we do is that we take, when we get the prescription back with this first set of aligners, what I do is I have my Invisalign coordinator evaluate how long that initial bonding appointment of those attachments will take, and then we adjust it on our schedule template for that particular patient so that we can open up any additional time if that initial bonding appointment of those attachments is not going to take the full 60 or 80 minutes.
Great, thank you. So we're receiving many questions now in the Q&A portion, so we appreciate your engagement. The next question, Kathy, if you could, what is the ideal team to get an Invisalign patient started and tracked appropriately? Staff structure, touch points, timing, follow-up, best practices.
Jordan, can you do me a favor, because that's pretty in-depth. Can you repeat the question again for me so I can write some notes down, please?
Absolutely. What is the ideal team to get an Invisalign patient started and tracked appropriately? And then they showed some examples. So based on staff structure, what are the common touch points, what's the timing, and what's a standard follow-up?
Okay, so particularly in our practice, so this is a great question. Holy smokies, lots of dimension to it. So with the schedule, similar to Michelle, we don't designate a specific assistant just for each adjustment appointment, which we call deliver aligners, in order for the entire practice to be very comfortable with aligners. A big thing, and Jordan, if you could help me make sure that I hit every point on this. So in the schedule, what's really nice for us in efficiency is we work in a 10-minute unit. So our deliver aligner appointments are a 1 unit, where our traditional patients are a 20-minute. So what we really like is we're able to see more patients, but also have more breaks in the template so that we can see 2 to 3 patients back to back in each chair, and then have a bit of a break so that if, for some reason we fall behind, we have an opportunity to catch our breath or maybe even just take a quick breather, and then move into the next section of patients. And so that's where the aligner deliver appointments are so efficient for us, because we're able to see more patients, but actually create more time in the clinic that we can focus on being on time. So I think that answered one question. If, Jordan, you could help me make sure I didn't miss a segment, or even Heather or Michelle.
Right. So if you could just touch on the appropriate staff structure for getting a patient
The appropriate started. Okay, so I guess I'm not 100% clear on where we want to go with this answer. So, the flow is, the treatment coordinator sees the patient, with the doctor in the consultation. Then we schedule, we are a very large same-day records office in Taylor. So typically in a perfect world in our office, we would like to scan immediately. I highly, highly, highly suggest that everyone have an iTero, or at the very least be looking at the new Element. In Detroit, we're actually going to scan our Invisalign patients in our intake on the consultation appointment. So how the flow will go is I will scan with the Element. I will then do photos, pan, then we'll be able to use the simulator in the consultation appointment. So this is essentially will be eliminating the records and the time in the clinic, so that the very next appointment can be that start and that what we call, initial deliver, where we attach it, start with the attachments. So Jordan, if you want to see if I kind of come into that.
Good start. I think that's a good start, yeah. And we have a couple other questions that will kind of be addressing these, so we don't have to answer them all right away. So we'll move on to the next question, and I appreciate that answer, Kathy.
Thank you so much, Jordan.
Mm-hmm. So what information should we be targeting to better understand mom's concerns? In our sessions, I always feel like I'm not getting the full picture, but struggle to bring that out. Michelle?
Excellent. So I'm going to answer this as if it were either the treatment coordinator or the doctor in the exam process. And I'm a firm believer in the scheduling coordinator having a great script and a great intake form that can gather some information to help lay the foundation for the treatment coordinator to initiate and move into the exam with some kind of an idea on how to find the value point with this family and for this mom and for this teenager, and then to be able to adapt their exam process for what is important with this mom and what their concerns are. Again, we can find out some great information when mom is scheduling the appointment. Is it a challenge to schedule? Is mom's personal or professional schedule difficult? And we can gather that information right at that initial phone call. And it's very important that the scheduling coordinator takes those notes down and provides that information to the treatment coordinator to then utilize in building the value point for the patient, such as how easy Invisalign treatment can contribute to a family's busy schedule or a teenager's commitments with athletics and school and so forth, allowing them to miss as little as possible. So it is really a good opportunity for the scheduling coordinator to not only move through the call slip, but to be able to know what information to gather that is important to help lay that foundation for the treatment coordinators as they go into their new patient exam.
Thank you. Okay, this question comes from Sarah M. What do you feel is the best way to get patients started with Invisalign the same day as their consult? Kathy?
Well, I think the key is first and foremost, you have to make sure that the reason that you're asking for that same day start isn't because you're asking for a start today. You're actually truly and sincerely trying to save the family an appointment. So I would say that has to be the reason that you even ask for them to stay. So I think how it goes as a TC is you say something along the lines of, in order to save you an appointment, Michelle, we can have Noah scan today, which then means we will only need to bring you back one time versus two, which will be when we'll deliver Noah's aligners and he'll get his attachments and he'll be on the road to this wonderful, healthy, beautiful smile with superior technology of Invisalign. I think the key is when you ask for that, first of all, you have to ask for them to stay. You can't be afraid to ask for it. But as you're asking for it, use from the bottom of your heart the fact that you're trying to deliver excellent customer service. You're not just trying to get a start. So you say, so again, you say, what I really want to do, Michelle, is I just want to, I want to help your schedule. I know how busy you are. So what I can do is save you an appointment by us going ahead and scanning Noah today. It takes about 10 minutes. We can get you, while Noah's getting scanned, we can get you started within your contracts, because I know you can't wait to have Noah get started and, help improve his self-esteem and making him feel better and great. I would say that has to be the approach when you ask for that start. And you can't be afraid to ask for it. Thanks, Jordan.
Thank you. Okay, Michelle, I've heard in offices using iTero and ClinCheck as part of their consultation. What's the best way to do this, and where in the patient flow would this work most effectively?
That's an excellent question. So just as Kathy stated earlier, I combine as much into that new patient exam as possible. So we take our x-rays and our photos as part of our new patient exam. And with the iTero, it provides us an excellent opportunity to be able to work around that treatment simulator. So what I do within a 60-minute exam time slot is to be able to grab and utilize any tools that I can to create an excitement and an enthusiasm. So I actually have a sample patient that I pull up. I love to pull up a ClinCheck and show them the great process of being able to see the movement along the way. And really that helps to also prepare the patient for what the attachments are going to look like and actually having the attachments on the teeth. I also am able to show them, with rubber bands and what's going to be happening with their occlusion for that. So it's a great preparation tool. It really gets patients excited about the process of what Invisalign provides them.
Thank you. In keeping with the scanning theme, Kathy, do you ever have people go ahead with a scan but then back out? How do you handle that?
I think a key for us is the fact that we actually do the contract that same day in the records. I would say that something that's very important for me to clarify in this answer is the fact that we have, at the beginning of this year, January 1, we are now a ortho finance that's like FI Frank Indy. So it's very easy for us to create the contracts the same day as a consultation. Our families have a lot of flexibility with their down payment and their monthly payment. They're actually making those decisions themselves. We're not telling them what they need to put down. So that makes it very easy for them to do the contract at records at the consultation appointments. I think that's very important for me to disclose. So that's, I believe, why you don't have families backing out, is because of the fact that as a patient's going back to get scanned, we're doing our financial paperwork. We're putting them in the contract, and we're getting something down, something small, so that there is some skin in the game, so there is a financial commitment at this point, too. We do use a records, so if you don't complete treatment in between records and delivering of initial aligners, they are responsible for $1,880 with our office. So if, let's say, they do records, we scan, we get the aligners, and then they don't commit and come in and start aligners, we would charge that fee. But knock on wood, we really don't have that happening. Like, I can't even think of the last time we had something like that happen, where a family changed their minds after signing the contract and committing to starting treatment with us.
That makes sense. Appreciate that. Michelle, do you show a new patient the ClinCheck in every consultation, or only when they're requesting certain information about the treatment, i.e., when they say, will my teeth look like that in the end?
I should clarify with that. I do not do the treatment simulator on every patient. What I do is I show them it's actually my son's ClinCheck appointment or ClinCheck that I pull up and I show them. So they aren't asking me if their teeth will look like that. I love to show them and talk with them about what an ideal occlusion is and what our goal is and what we're going to be aiming for. But really what I use that tool for is to prepare them and show them what they can be expecting with their Invisalign appointment. I actually do this on every patient coming into our office, just educating the families on Invisalign treatment. Now, that may not be the treatment that doctor recommends per se for this specific patient, but it's a great opportunity to generate additional new patient exams at any opportunity. Mom might be interested, or mom might think her husband really needs his teeth, worked on, and straight teeth and a better smile, but she knows he's not going to be in braces for 2 years. So it really opens up the door for the families to talk a lot about it, ask a lot of questions, and possibly either for themselves or for their spouse and so forth. And so I just use that as an educational tool about the treatment modalities that doctor specializes in and is an expert in.
Great. Kathy, what activities are best delegated to the RDA, and what are the best to stay with a doctor to be more efficient without sacrificing patient care? I'll repeat that question. What activities are best delegated to the RDA, and what are best to stay with a doctor to be more efficient without sacrificing patient care?
Okay, so great question. Thank you. So in our Taylor office, we have the doctor place the attachments. So I think that, again, that gives strength and value to the fact that these families selected this doctor out of all doctors because he's the best. So our assistants, they will fit the aligner, make sure they're tracking, ask questions about where, make sure the patient's, been very compliant, which we've been very lucky and blessed that they've all been. For the most part, we have a lot of super compliant Invisalign patients. And then bring Dr. Mike into the deliver aligner appointment so that he can then check the fit of the aligners and that the patients are, tracking as they should be. But again, Dr. Mike is the one that places the attachments. In our Detroit practice, this is also going to be how we handle it. Our doctors are going to be placing the attachments. So I believe that was the question, is how do we utilize the assistants with the doctors? In the deliver aligner appointments, again, the assistant will check alignment, tracking, wear with the patient, ask how easy it is. One thing I really want to start implementing is Michelle's suggestion of reviewing the ClinCheck with the patients at those Deliver Aligner appointments. Again, I think it's a super important thing, so thank you so much, Michelle, for that suggestion. Brings value into the treatment. It keeps the excitement of the treatment throughout treatment, and then Dr. Mike comes in, he checks the wear, makes sure everything's fitting correctly, and then, away we go. And we see our patients every 12 to 14 weeks in Deliver Aligner appointments. So thank you, Jordan.
Thank you.
Jordan and Kathy, if I could add a little bit to that, actually, and just go a little bit deeper, Kathy, with what you touched on with opening that ClinCheck. We do open the ClinCheck at each aligner delivery appointment, aligner adjustment appointment, and our appointments are 10, 15 minutes long for an aligner adjustment, and patients come in, their ClinCheck at every chair is opened automatically. We get to really celebrate with them the movement that they've just achieved, and then we get to look forward to the movement that they're going to be achieving with these new set of aligners that we've delivered. It also really aids in very clear communication between the doctor, the technician, and the patient, and knowing as well when IPR is needed or any attachment adjustments are needed as well. So like Kathy touched on, it is a great opportunity to continue to build excitement and enthusiasm and to help our patients feel engaged in the middle of their treatment. That also aids in building with our referral program because it really keeps the excitement at the forefront of what our patients are going through, not just celebrating at the end when they've removed their braces per se. So I hope
I wanted to weigh in a little bit more. Sorry. And on that note, sorry, Michelle, but as Michelle said, the other thing is Michelle's talking, and as Michelle's been teaching me to implement this practice in our practices, is the fact that, again, I think something else is it builds the value that this isn't just plastic, that there's a lot of science, there's a lot of the orthodontist education that's coming into play in this treatment. Like this isn't just plastic. We had to have the doctor and his knowledge in order to be able to do this. And that is one of the biggest reasons why I think we have to do these ClinCheck reviews in those adjustment appointments, in those Deliver Aligner appointments, because not only does it keep up the excitement, but it also reiterates the value of, again, coming to the orthodontist and the specialist. So thanks so much, Michelle.
Absolutely.
It's a good dialogue that we're developing here. So Michelle, we have a question here. How do you incentivize hygienists to discuss Invisalign during recall appointments?
You could have a bonus set up where, for every Invisalign exam that is done, there could be a $25 bonus structure set up with that. It really varies depending on if you have an orthodontist within the walls of your practice as well, and we want to bridge the gap between those two. If we're talking about just a GP office, a general dentist office, what I really like to do as an orthodontic office is to build that relationship with our hygienists especially and help them to understand how a treatment modality such as Invisalign can really diminish the oral hygiene burdens that they deal with their patients. Let them really understand the importance of that to our practice and how we want to create a treatment team with our hygienists. So I find that when there's something in it for the hygienists and for their patients, then they really become believers in it. And I want them to know that I'm their support, and I want to be a part of the treatment team for them. And a treatment modality such as aligner treatment really, really does diminish those oral hygiene burdens that our patients and our hygienists have to deal with fixed bracket patients.
Thank you. Kathy, how do you tell patients they can need a realignment? What's the positioning that you use?
Oh, great question. And I think that now with the changes with Invisalign, everyone, not that I think we do it the best way, but I think we do it the best way. First of all, any consultation appointment, it starts there. You have to make sure that you're communicating with the families that there is going to be multiple sets of aligners. sense the changes. Okay, these changes that Align just made for all of us are absolutely fabulous. I hope everyone takes advantage of these. We don't have to worry about mid-courses and refinements anymore. And so now it gives us the ability to do exactly what we need to do, is create these beautiful, healthy smiles. So you have to take advantage of them. So don't kill yourself in those. I would say to the doctors, you need to not kill yourselves in those ClinChecks and get yourself out of the mud, as how I think Dr. Diane says it. And Dr. Glazer, I think, says, you make it easy on yourself and get things started and use the ability to get more aligners at no additional cost. So in the consultation appointment, as a TC, I'll say something, I'll explain, I'll show the patients how the aligners come in the bags, and I'll say, listen, don't go count anything on your calendar. Don't look at that number, 23, 1 out of 23, and go circle anything on your calendar, because Dr. Mike is a perfectionist, and he only wants to make sure that you have nothing but the best, because he's such a perfectionist, and he is the best orthodontist. So what's going to happen is you're going to get a few sets of aligners, at least 2. And so you want to make sure that you go by the time that Dr. Mike said. So if Dr. Mike told us that you're going to be around 14 months, that's what you circle on your calendar. Because, again, when you get through that first set of aligners, because he's such a perfectionist, you're going to probably have a few more aligners after that. And you wouldn't want it to be any different, because that's why you picked him, because he's the very best. And then everyone else in the practice has to be consistently communicating things like that too. And we have been doing this for about 2.5 years, and we don't have patients because we were like the refinement capital of the world. We did a lot of mid-courses and a lot of refinements. We have 2 scanners. We have 2 new elements coming. We rescan, and it's about quality of experience and quality of life for the doctor even, and using those refinements. And so we are consistently communicating, and we have not had families pushing back. We don't have patients sitting down saying, oh my gosh, I can't believe I have to be rescanned and I'm getting more aligners. They're all fully aware that that's going to happen, and they want it to happen because, again, you've stressed you don't want anything but the best, and he's a perfectionist, and you picked the best. And so this is the benefit to you. It's all about turning it back into the benefit to them.
I think that's a really great way to position it. Thank you. Okay, so this will be the last question for this particular section. So all attendees, you can start to direct your questions towards scheduling. So the last logistics question would be for Michelle. What information should be gathered up front to make the appointment run smoother and give the doctor and TC what they need to be successful in getting a start?
Great question. I do think we touched on that in the beginning a little bit as well. And clarified a little bit for me, Jordan. Is this questions on the intake call, scheduling a new patient, or are these questions within the exam?
So this is the intake, I believe.
Okay. So really we have our general intake form where we're getting their address and their phone number and all that general information. But what I like to do is I like to ask if they've ever seen an orthodontist before. I like to ask if this is a concern of their dentist or of their personal concern, and to understand what that concern is as well. I also want to understand obviously how they found us, what they are looking for with their treatment and with their provider. And if they have any thoughts or ideas on the specific treatment that they're interested at that time. So that tells me a lot ahead of time going into the exam. I'm also going to have my scheduling coordinator really promote the treatment modalities that we specialize in. And so during that new patient phone call, we have a little paragraph in there that says to the patient, doctor is, an elite status provider. We specialize in Invisalign aligner treatment, and you can learn more about that on our website and send them to our website for that as well. So that generates an excitement and enthusiasm before the patient even comes into our office if they have not had a preference on what their particular treatment modality might be. And then again, as I stated earlier, I bring them into the exam process, and I just use that time right away to educate the family and the patient on what options that they'll have. And then doctor comes in and has a recommendation for what treatment is going to be best serve this patient. So I hope that answered that question, Jordan.
I think it did.
Jordan,
Okay.
I'd like to add, Michelle and I, she and I this week have been spending a lot of time on intake. I would think, Michelle, if you agree, this is a good time for me maybe to add the line that we use at the end of our intake form regarding having all the financial decision makers present.
It did, and Kathy, I noticed that was a question as well on there, so I think you're going to be answering somebody else's question, so I think it's a perfect time.
Okay. All right, thank you so much. Okay, so what I want to add to the intake is at the end of our intake form, we have a paragraph that's, that all of us are trying to make sure that we use all the time, is we kind of in the part of closing will say, Dr. Mike feels it's very important for NOAA that any and all financial decision makers try to be present for this appointment. And we also, in parentheses, have dad, grandparents, those sorts of things. If anyone's ever seen Rosemary Bray, they've heard her talk about the yellow box and her grandmother who helped pay for her orthodontics. And we have a lot of grandparents that do come to our appointments, and I think it's because, for instance, at our front desk, Susan is very good at communicating this and getting all the financial decision makers present at the consultation appointment. So what you want to say again is you want to say, Dr. Mike feels it's very important for NOAA that any and all financial decision makers are present for the consultation. We all want to ensure that NOAA gets nothing but the very best. So I think that's an important piece to add to your intake form, and trying to get to your decision makers there, your dads, your grandparents, whoever it might be. You might even have a situation where we have this happen quite a bit, our blended families. So we will have mom, stepdad, dad, and stepmom, and all of them at the appointment. But now this gives us the ability to be stronger in that same day start, which is a strong premise at our office. So thank you so much, Michelle and Jordan.
Yeah,
Thank
that
you.
was some
Appreciate
great
you adding color
information,
on that.
Kathy.
Really appreciate it. Okay, moving on to the next section, scheduling with Invisalign. Our first question is, when a patient is also having an accelerated treatment such as Propel or Excelident, how does this affect scheduling? Michelle?
Excellent question. And what a great option and opportunity that those accelerated options provide both our practices and our patients. A lot of different offices will do it differently. They will deliver additional sets of aligners, which is what we do. We will have them change their aligners in half the time as normal, and if they are not doing the accelerated option. And then we will extend their weeks out a little bit as well. So we're delivering a good number of aligners to our patients. Initially, we'll see them a few times rather quickly, within a month, 4 weeks, 6 weeks, to be able to check and make sure that they're wearing their aligners as expected, their teeth are tracking as expected, and then when we can understand and know that they are compliant with these appointments, then we'll be able to deliver those additional sets of aligners. We don't go out a significant amount of time beyond what we normally do because, again, if there is some noncompliance in there at all, we don't want too much time to go by with that as well. So with those accelerated options, we have those patients flagged so that we're all on board with it. There's communication and synergy from the front desk to the clinicians to the doctor, and we know that this patient is on the accelerated path with it. We do not adjust their appointment times on the schedule template because we do need that 10, 15 minutes to be able to go over their aligner deliveries with them. Did that answer that question, Jordan?
I believe it did. Thank you. So, Kathy, when should you do rescans? When you see the patient did not make an expected movement. So, in other words, when patients don't make expected movements, how often do you do rescans? What's the timing around that? What's your best practice?
Typically, okay, so at our practice right now, we have a procedure code called DB Second Series Rescan. So this is towards the end of the first set of aligners. We're looking at this point, Dr. Mike is going to, like 9 out of 10 times he's going to say, we need to scan, we're going to need 6 more aligners. something along those lines. So it's typically towards, the end of that first set of aligners. So I'm going to say, and we're probably looking at our average treatment time is about 14 months. So we're talking right now, we're at the 11-month mark, 11 or 12-month mark. I will say again, we are the home of Rescan, and we have those iTeros, and so you need to make sure you're utilizing them. And again, now there's no excuse for us not to rescan. So I would say rescan whenever you need to. If you've got a patient that's not tracking properly, get them rescanned and get them some new aligners. We're a big office using Class 2 correction and even now Class 3 correction on the lower. So you go into treatment, you start with a carrier distalizer and we start with the lower aligner with the carrier distalizer on the upper, and then we rescan once we get that bite corrected, and now we're going after alignment. I would just say it's kind of where the orthodontist thinks it's best. Have a scanner in your office so you can rescan when you need to. The scans don't take that long, and with the new elements, it's going to be even smoother. So you're not going to have to worry about balking up your schedule too much rescanning. Thanks, Jordan.
Thank you. Okay, Michelle, how do general practices schedule the Invisalign aligner deliveries throughout the day and still get other doctor production time in?
When you say general practices, are you talking about GP offices or general ortho offices?
Let's go with general ortho
I'm going to talk. Yeah, I'm going to talk about an ortho office. So ask the question again so I can have some clarity.
How do general practices schedule the Invisalign aligner deliveries throughout the day and still get other doctor production time in?
Okay, I'm going to break it out into two. An aligner delivery, I'm going to talk like their bonding appointment, their initial delivery, where we're spending anywhere from 40 to 70 minutes bonding those attachments, doing any IPR, delivering the aligners and the instructions. So it's just like a normal doctor time schedule that we'll have, and we have our RDAs that will do the majority of that education and that process, and then the doctor comes in for those bonding times. So it doesn't affect the schedule any differently. It's actually much better because it's so much less doctor time than the full bracket bonding appointment. So it opens up much more doctor availability in our schedule, same as the aligner delivery or aligner adjustment appointment when patients are coming back to get their additional sets of aligners. The doctor chair time is so much less than in the wire adjustment appointments. So in fact, it actually does open up our schedule a lot easier. And you can see on that sample schedule that is on the slide deck right now, where we have a significant number of Invisalign appointments put into this afternoon time spot, and we don't have the same amount of room to have the same number of those adjustment appointments if I had to add those in there.
Great.
Thanks for that question, Jordan.
And to all the attendees, if you wanted to get a sample, your own copy of this particular sample, just go to ssignatureconsulting.com, the address down at the bottom of the screen. Okay, Kathy, what's the longest you are willing to wait? What is the longest you are willing to go out in between visits with a compliant patient?
We're actually very comfortable giving many sets of aligners to patients. We've been very lucky. We have very compliant patients. We actually, to all of you treatment coordinators that are battling with the question of whether a patient's going to wear their aligners, knock on wood, we have our patients almost wearing their aligners too well. We have to stress in our office that they have to take them out to eat. So my 15-year-old is just finishing up Invisalign right now and has been caught eating with his aligners in, with his orthodontist sitting at the table. So patients do wear them. So we are very comfortable going far out. So we typically schedule our deliver aligner patients 12 weeks. 12 is a very comfortable number for us. We've been known to go 14 weeks. We've been known to, with our college students, to see them when they're home. So if you think about that, that's going to be Thanksgiving, Christmas, spring break. so that's 3 times in a matter of the, essentially the 14 months that they're going to be in treatment. Again, we've been very lucky. We have very compliant patients because I think we have an exceptional team who is wonderful at educating them, because I think when you don't have compliant patients, a lot of that has to fall on our shoulders and whether or not we're educating them properly. So we'll go as far out as we need to, and we use that as a sales point in the TC. In the consultation appointment, we will say to that mom that has many, many children and has travel sports, we'll say, hey, when you're in that busy time of the year during travel lacrosse season, because I know Noah's going to do such a great job, we'll be able to see you less frequently than we would our traditional patients because of the flexibility we have with the aligners.
Great, thank you. And it sounds like you have a really good patient base.
We do. Like I said, we are combating right now patients wearing their aligners more than they should. So we tell our patients to wear their aligners 23 hours a day, 7 days a week, and to take them out to eat or drink, that they can drink water with them in. And like I said, my Noah was caught eating with his aligners in and with orthodontists at the table because he just wasn't even thinking and he didn't take them out. And so now we have this switch in our office where we're having to consistently educate our patients when they come in, our aligner patients, saying to them, you have to make sure you take them out to eat. Make sure you take your aligners out to eat. You can only drink water with them in because of the fact that, I think the patients, as an Invisalign patient myself, my teeth felt really weird when my aligners were out, and that sensation is gone when your aligners are in, and so that's why I think patients are leaving them in so well. So again, like I said, that's the wave that we're riding in our office right now is having to stress the patients to take them out when they eat.
Great, and thank you for articulating the nuance there. Okay, so for the last part of this section, we're actually going to refer back to a previous question. There was some clarification requested in terms of incentivizing hygienists. Michelle, could you speak to that?
Yes, absolutely, and I think I'm really thankful for this opportunity. In my initial answer to that question earlier, I was giving 2 different answers to 2 different scenarios, and correct. It is a violation of the state board practice guidelines to give a monetary reward to our colleagues in exchange for referring patients. And so my initial answer was the scenario when we have hygienists within our practice. Many of our clients have that service within their orthodontic practice, and I want to be able to bridge the services within the practice for the patients in that area and not encouraging 2 separate entities. So that is when it is a part of one practice within the same doctor in the same practice. And then on the other side of it, when I was talking about building that treatment team with our hygienists and really helping them to understand the value that we put on lowering those dental health burdens with our mutual patients, that would be an external where our hygienists are the colleagues outside of our practice. So I hope that clarifies that question that we initially touched on earlier.
I think it does. Thank you. Okay, so moving on to the next section, workflow and solutions for small or large practices. Our first question is an interesting one. It says, we have a patient who hasn't been heard from in months and still has 1 aligner left and an account balance. He won't return our calls or emails. What would you recommend? Our office normally never sends patients to collections because this doesn't happen often. Kathy?
Okay, so we have a patient that has 1 aligner, has a balance, and won't return our calls.
Correct.
So if the person asking this question could give me a little more clarification, are we talking a high balance or are we talking a low balance? Like where are we at in this? And then what I would say is if the balance isn't ridiculous, like, let's say under $1,000 or even under $500, I think it's important to call and say, first of all, I would try in that first call, and I know you've already called, saying something along the lines of, so Michelle, this is Kathy from Dr. Lanzetta's office. Dr. Lanzetta asked me to give you a call. It's very important that you get back with me as soon as possible so I can get you scheduled for that last aligner so we can get your treatment finished up. I'm so excited to talk to you. Try to keep it positive to get them in. Now, if they have a fairly reasonable balance with us? And Jordan, have you gotten the answer back on kind of where at is this balance?
$600.
Oh my gosh. Okay, so whoever asked this question, this is what I would do. I would call them up. I would say, Michelle, this is Kathy from Dr. Lanzetta's office. I'm so excited. You're so close to finishing treatment. Please give me a call as soon as possible. I know you have a fairly small balance. I'm going to be able to help you out. Dr. Mike has given me some flexibility to help you with that balance. So please call me right away so that I can see about maybe making that smaller for you. And what I would do is, some money's better than no money. They've gone MIA on you. You got to get them in. I would offer them a settlement, just like the collections agencies do, to create some urgency. And if you can spin that phone call in a positive way so that they call you back. The other thing I would say too is, don't try to call at 8 a.m. either. Like, take this number home with you and call in the evening. Again, you have to, try to use that collection agency mentality. I would not turn somebody over to a collection agency for $600. You're going to pay a collection agency 50%. Typically, across the country, it's a 50%. Why not just do that yourself and try to communicate that in your voicemail to them? I would email them. I would potentially try to text them, just saying, hey, I can work with you. Dr. Mike has given me some flexibility in order to offer you a settlement because we're just so excited and you're so close. So, just please call me so I can help you. That's how I would handle that one.
I think that's a great way to position it, and you're right, some money is better than no money. Okay, our next question coming in from Michelle is, I have a boutique ortho practice. What's the best way to handle the consultation, speaking to mom and the teenager, and how is it done differently in a larger practice?
I actually don't recommend it being done differently than in a larger practice. I train on the appointments looking a certain way, and I train treatment coordinators to be the experts in running those particular appointments. So our treatment coordinators should be trained in sales techniques and psychological sales techniques to be able to really influence our patients throughout that process. So really, across the country, studies show that the longer a doctor is in the exam room, the less conversion rates we have. So that is not a study that I ran, but it is a study that is out there. And what I do is really encourage doctors to be in their exam for about 7 to 10 minutes. And I want the treatment coordinator to be in the exam with the patient the entire time as the expert with that patient, as the patient's advocate, really building that relationship. I recommend the treatment coordinator being the one to initially present the financials to the patient, not bringing in a separate financial coordinator, and allowing the patient to really get comfortable with this one person and to know that this one person is going to be their true advocate. Because in that scenario, we are able to get the truth behind any barriers there might be with a patient starting. And when we have the truth, we can creatively address that. I don't want a patient just to give an excuse or a quick response off their tongue. I want to really get to the bottom of it. I want the truth behind what really is the barrier to them starting treatment. And as a treatment coordinator in that 60 minutes, building that relationship with that patient, I'm really able to accomplish that. So that's how I set up my exams, whether it is in a boutique practice or whether it's in a large practice.
Thank you. Okay,
Thanks,
Kathy, how do you deal with patients who want to finish treatment before the end of the amount of trays needed to be completed? Sorry, let me repeat that question. How do you deal with patients that want to finish treatment before they end the amount of trays needed is completed? In other words, patients who want to treat faster.
So what's happened is the social teeth look really great, and so they think that they don't need to continue with their aligners. And that's another thing I'd like to suggest, that everyone get the word tray. Sorry, this is just a little picky thing, but get the word tray out of your vocabulary. This is high-tech orthodontics, and we all need to be using the word aligners. So sorry, a little tangent there. But I think this is, super, super important that you build the value in your doctor, and that's why they pick the doctor. You have to flip it. Anytime as salespeople, we always have to flip it back to, and this is where the assistant's going to be the salesperson in this situation, or the doctor, flipping it back into the patient's or the parent's lap and their benefit. Where's the benefit to them? So they're hurting themselves by not continuing their treatment and finishing their liners. And I would be so surprised. So let's say Michelle is saying to me she doesn't want to finish because her teeth, the front teeth are looking good. Well, I would say to her, okay, so Michelle, you came to Dr. Mike because you only want the best for yourself. So let him do that for you. Let him finish your treatment exactly the way it should be. I can't imagine that you're the type of person that wants to cut corners on what's best for you. And I know you picked Dr. Mike because you know he's the best. So let him be your doctor and let him do the best for you. And that's why we have to go ahead and finish up those aligners. And it's not going to be that hard. And then maybe you have the doctor involved in this conversation too, so that the doctor can help reiterate why. And I think, again, I can take this right on back to Michelle's suggestion that we all should be reviewing the ClinCheck, because then the patient can see what's moving at that point. So the social teeth look good. Maybe we're moving molars, and so they don't see the movement. So I think if you're consistently reviewing the ClinCheck in those deliver aligner appointments, maybe we're going to have less opportunity for patients to try to be the orthodontist and say that they shouldn't have to finish their aligners.
Thank you. That's a good answer. So Michelle, in our office, assistants do the entire Invisalign case with patients. Should we be having our doctor come in and check the aligners for every aligner check?
Absolutely. Just as Kathy touched on earlier, we really want to promote and build our doctor's value and his expertise with this. The same in the exam or when we're initially presenting to patients. I never present the fact that it's going to take 2 to 6 weeks or 2 to 4, whatever it is in your practice, to be able to get your aligners back. And in the meantime, Invisalign is going to be making your trays. No, I built huge doctor value in the fact that the attachments are strategically sized and placed based on the prescription of tooth movement that doctor wants to achieve. And during this time, doctor is going to be doing a virtual treatment plan and working up your case. It's all about the doctor's value and the doctor as the expertise in doing this treatment. Same thing that Kathy was talking about in just using the verbiage with trays. We want to really understand the importance and the value behind this as an actual science, because that helps support our treatment costs as well. So I definitely recommend the doctor coming into every appointment, whether it's for 2 minutes or whether it's for 7 minutes, depending on the layout within your practice. But it just really helps our patients feel like our doctor's vested in their treatment, and it really supports that we care for their treatment, we care for this process with them, and we're here to give them the absolute best. Yes, aligner treatment provides us a lot of benefits in less doctor time and so forth, but we definitely want the doctor to be able to come in and check in with the patient, check and make sure that everything is going as the doctor prescribed initially.
Thank you. Okay, we're coming up to the end of the hour, so we can only fit in 1 or 2 more questions. Kathy, how can you increase the use of Invisalign in a large general dentistry practice with 4 general practitioners and 8 hygienists?
Okay, so we have a large general office that we want to utilize Invisalign with. I would say that the key is going to definitely be, looking for those cases that aren't going to take a ton of doctor time. So at our practice, Dr. Mike, as an orthodontist, really loves the opportunity to help the dental offices grow any way we can as a team. So we are consistently encouraging our dental offices, and these are our sister offices. We're in this together. So we really encourage our referring offices to get into presenting Invisalign in their offices. It's a great opportunity for them to increase their revenue. And again, it helps us all. It makes us all better. I would say, though, finding the best opportunities, making sure that they're not going to be these really cumbersome alignment cases that you should be referring to the orthodontic office. You know, those cases that aren't going to consume a ton of the doctor's time, ClinChecking and monitoring. I would. This is going to sound bad, but I would look for there's ones that are going to give you the best financial gain. You're not going to have a ton of time in them. You're going to have great results, and so that's a great revenue opportunity for us as a practice. If it's a more extensive case, then, I would, as obviously from an orthodontic office and just being really honest, I would say please refer those back to us and let's work together. Those cases that are going to be not as time consuming for the dentist to watch and to monitor and to deliver, those go to the dental office, and the more extensive cases come to the orthodontic office.
Thank you. Okay, we have time for one final question. What about checking interproximal contacts and interocclusal contacts, DDS or RDA? Michelle?
That's a broad question. I'm not really sure. What do you mean checking? Our RDAs definitely will check those contacts to make sure they are what is prescribed on the doctor notes, but again, our doctor comes in and checks every time with our patients, and so we'll make notes if it's tight or if it's not tight in this particular area, and the doctor will come in and double check on that. I also saw a question about the appointment types with the IPR and interproximal reduction as well, and those appointments are the 15-minute or the 20-minute Invisalign appointments as opposed to the 10 minutes where they're just going to be delivering some new aligner trays. And that's for opening up the ClinCheck again, helps us to confirm and make sure that we're going to be delivering the right number of aligners right before an IPR is needed as well, so it can be really efficient when the patient is actually coming back for their next aligner delivery appointment. So I hope that answered that question.
That's very helpful. Thank you. Okay, everybody, I want to thank you all for attending and for your wonderful engagement. As is on the screen right now, please proceed to that link and fill out our brief survey. On the second page of that survey, you'll see the link to get your certificate for your Align CE hour. Thank you again for attending. I appreciate it. And Heather, take it away.
All right. Thank you so much, Jordan, Michelle, and Kathy, for your presentation today. Ladies and gentlemen, I have put the survey URL in the chat window so that you can easily copy and paste it into your browser. And it will also pop up once we exit the session. So with that, thank you all so much for attending and for all of your great questions today. This does conclude today's session.